Our first speaker is Antony Tiernan, who's Director of Engagement and Communications for the NHS 5-Year Forward View New Care Models programme. He's previously Director of Comms at West Hertfordshire Hospitals. The first time I saw Antony, you won't know this, but I was in the room where you were speaking at an NHS provider's comms event, and you were double-heading it with your Chief Executive. And Antony presented on what he needs from his Chief Executive to be a good communicator. And the Chief Executive then presented what she needs from her Director of Comms. It's brilliant. So I took those lessons back to my own Chief Exec and said, this is how we should be working. And she looked at me and said, aren't we already? But some, I think, get it better than others, and I think you were very fortunate there. So thank you for that. So we're going to hear from Antony now, and I hope you give him a warm welcome. And there'll be time at the end for questions. But as I say, we've got Slido, so pose your questions on Slido as well. Thank you.
Thank you very much, Caroline. Can everybody hear me? At the back, great. Thank you so much. Hello, my name is Antony Tiernan. I'm the Director of Engagement and Communications for the New Care Models programme, which, as Caroline said, is part of the NHS 5-Year Forward View. I am going to do a brief plug for that. I wouldn't be allowed to be here if I didn't quickly talk about the vanguards, so I will talk about them briefly. But the question I'm talking about is, why is social media important in healthcare? And when I say healthcare, it isn't just about the NHS, it's much wider. And I think importantly, the connection between healthcare and local government and how we're working across different areas. So also looking at housing associations, how we work with the voluntary and community sectors as well. And I think fundamentally, just a little bit from me, some top tips, and I'm not the world's expert, I promise you, and there's better brains in this room today, but just some top tips from me about how I and the teams that I've worked with have been using social media over the last X number of years to do that. So just a bit briefly on the vanguards. So there are 50 areas of the country that are trying out new ways of working to deliver improvements for patients on the ground, but also it's about preventing ill health and about saving money, and they were the main three aims of the 5-Year Forward View. There's sort of 5 different types, so some about joining up care in the local areas, so connecting up mental health services with community services, with hospitals, with local government and others. Some are about connecting up hospitals, so creating chains of hospitals so we can share the expertise, whether it's the back office functions, whether it's about sharing staff or about sharing the expertise between specialties. And we're also looking at urgent and emergency care, so how we make what is a very complex system for patients in particular less complex, so people can understand where they should go when they need urgent and emergency care. We're also, and this is my favourite I have to say, giving more support into care homes, recognising that a lot of the people that use our GP and our hospital services are people in care homes who aren't necessarily always getting the care that they need. So how can we put better support into care homes to avoid those people needing those services in the first place? And then last and definitely not least, we're looking at how we can get specialist care out of hospitals into the community, closer to where people live. So that's what the vanguards are doing. Vanguards aren't a individual hospital, they're not a community trust, they're not a mental health trust. They're partnerships of organisations, and that's what's key. And some of them are 2 or 3 organisations, some of them are 30, 40 organisations. And what they get for that, and what they get for being a vanguard, is there is money, so we've given them around about £300 million to date, but they also get access to support. And this is, I have to say, part of this job, and I joined the programme 18 months ago, is the hideous array of language that we use to talk about some of the stuff that we do. And the key thing that I hopefully have done when I talk to the vanguards and people I work with is you don't need to use any of this language. Please don't talk about being a vanguard when you're talking to patients and local people. Please don't talk about a multi-specialty community provider. Talk about how you're going to change things for patients and local people, and how you're going to change things for staff. And they don't need to know this terminology. So, but I still work within that, and we have to talk in this language when we talk to each other, otherwise nobody understands what the hell I'm talking about. So just here with the key enablers that we put in place. What's this? Well, we said to the vanguards, how can we help you achieve what we're asking you to do? How can we help you be better in the way that you work and create these new models? And I'm just going to pick on a couple of these and then start talking more about how this links me to social media and communications engagement. So if you look at number look at number 6. So we're saying to the health service, be better at the way that you connect up, be better at the way that you talk to each other. However, the computer systems that they run and they own don't talk to each other. The information governance rules that are in place don't allow them to share information. So we're working with the vanguards to overcome those challenges and to deal with them. Another area, number 8, is a good one to look at. Yep.
I don't know whether the screen can be refocused. We can't read anything on it from here onwards.
No. Okay, I'll read it to you. So number 8 is local leadership and delivery. So that's how we are supporting people in the vanguards. So if you look, so you're saying, okay, let's change the way that care is delivered and improve the care that we're offering. However, I am the chief executive of a hospital trust, which has all the pressures that we have. How do I do this? And how do I look after today? And how do I look after planning for the future at the same time? So it's about giving them support to be able to do both of those and the teams that do that. So that's sort of some of the areas where we're supporting them. So they get a package of money and they're also getting a package of support. And where I come into this is number 9 and number 5. So for people who can't read it, number 9 is about communications and engagement, and number 5 is about empowering patients and community. And social media is absolutely vital to both of those. So if we talk about communications and engagement, we know that when we make changes within the NHS, but also within local government, one of the main reasons why these programs fail, so change programs of all different sizes, so not just these major reconfigurations of hospitals we hear about, but even smaller programs. The reasons why they often fail is because we are poor at the way we engage and communicate with people, whether that's staff themselves, whether that's local people, public, politicians, media, you name it, the list is there. So we recognise early on that we need to be different in the way that we engage and communicate with people and have them involved in the journey from the start, clinicians and other NHS staff owning the conversation, owning the solution, and helping us to deliver it in a similar way with local people and patients, and having honest and real conversations with politicians and the media as we do that. It's not easy, and it's a massive challenge. We haven't got all of the solutions yet, but that's part of the work that we're trying to do. In a similar way, number 5 is about empowering patients and communities. So it's about saying we're going to redesign the system, but actually we want it to fit around the patients. And it's not about fitting around us and how we work and our systems that we have, and GPs here and hospitals there and mental health trust there. It's about fitting around the patients. And crucially bringing into that is how we then also involve the voluntary and community sectors, recognising they have fundamental roles to play in the delivery of what we do, and massive support that they provide to us and to the public, but also the role of volunteers. So one, yes, there's a massive resource that volunteers can give to the NHS, but also if people are more involved within running of the NHS, they'll understand its pressures, they'll understand the pinch points, and therefore they can help one solve the problems or explain the problems. Also, how we also support carers, identifying carers and supporting carers. So that's just the work that we're doing, and that's my plug for the New Care Models programme. But social media is key to this, and the 50 vanguards are using social media in the work that they do. If you go onto my Twitter account, there's a list of all the vanguards, and you can have a look at what they're up to and what they've been doing. I just wanted to talk a bit about the past. I've been in communications engagement for 20 years, and this is some of the changes I've seen over the last 20 years or so. I think the reason why I flagged this isn't just because I can remember the lovely days and how it used to be, but it's about just saying how things change. And I think there's a big message to us working in social media as well, that we love our current things, so we do love Twitter and we do love Facebook, but things are going to change even more over the next 20 years. And just to remember that. So there is a bit about, yes, loving today and really embracing it, but also thinking for the future. And are you spending time as communication engagement people and others looking at the next opportunities? I had the pleasure recently to work with a company that spends 80% of its time dealing with its clients, and the staff that work there deal with the clients, but then they give 20% of their time to people in the team to look at the future things, what's going to come up next, and how we can now be grabbing hold of them before they come from another direction, another company, another organisation. So just a quick things there, if you can't see them, top left, the original Facebook Top right, I remember being given one of these when I started in communication teams at Guy's in St Thomas's, a BlackBerry. I still understand some people in NHS communication still have those, which is quite sad. So BlackBerry there, bottom left was the original BBC News website, and bottom right, I remember joining up to this, was Friends Reunited, which was a bit of a precursor to Facebook in many ways. Top left was the pager. Again, I think some NHS Commons people still have this. So your radio signal pagers. Top right was news media, 20 years old now. Fundamental, I think, has really changed the news environment. I'm not saying it's gone away, it's not going to go away, but what's happened is it's all gone online as well, and it's all on social media. You can now get your news as quick on, from the telly as you can on Twitter, on Facebook and others. Bottom left is just the print media. I think we've been talking about its demise for many, many years. It hasn't gone yet. I think there's some way until it goes. But what has also happened is these papers have gone online. And if people don't know this, the Daily Mail is the #1 read news website in the world. It might upset a few people, but it is. So more people are reading the Daily Mail online than any other newspaper in the world. And bottom right is fax machines, which went many years ago, unless you work in the NHS. And I understand we're still the largest purchaser of fax machines in the world too. So, hey, a delight there. Why is social media important? I'd start, and there's a bit that I could have actually finished my talk right at the very start when I introduced myself by saying, hello, my name is. I had the absolute pleasure of working with Kate Granger, and hopefully people have heard of the Hello, My Name Is campaign that Kate launched and ran, and Kate died in the summer of this year. Kate was a doctor, and she had cancer, and she launched the Hello, My Name initiative on the back of the experience that she had of healthcare. Part of it was about seeing the basics not being done, and basics of, for instance, people not introducing themselves when they came to speak to her at the bedside when she was ill. And this was a way of her to say to people, get the basics right. It isn't just about the hashtag, it isn't just about introducing yourself, it's more than that. And it's about the relationship that we have with patients. And the Hello, My Name Is campaign, if there's one thing that should say, why is social media important in the NHS? To me, that sums it up. I think the impact that it's had on our health service across the NHS, and you see the lanyards, you see people using it, and you see people saying, you hear people saying it, has been amazing. I think we all, as people in the NHS, people in NHS communications, clinicians and others, have a responsibility to ensure that we carry on that legacy, and I think we owe Kate a lot to make sure that that continues and it doesn't disappear as we move forward. So, but I wouldn't end my presentation at the very start. I don't think that'd be fair. But I think that, to me, sums up why social media is important. The other reason why are these statistics. So these are the number of people using the different types of social media, and you'd be insane to ignore that with those number of people on there. I did a quick poll last night on Twitter, just asking people about what they thought of social media and whether they felt it was helpful in the way that they engage with patients, staff and local people. And the poll, this morning, was 105 people have said, and we had 39% of people saying absolutely, 38% of people saying so-so, 10% saying not at all, and 13%, it's all my favourite, saying haven't the foggiest. But you add those top two up, so the positives, you've got roughly 80% of people saying, yes, it has helped the way that we improved, it has helped the way we engage with patients, local people and staff. So it shows, but I do think there's a message there to us. There's 20% of people who don't know or don't believe it. So I think we've got a lot of work to do to convince people. I think back to when I worked at West Herts Hospital, and we had launched Twitter, and Twitter was running and it was quite popular. And people would use it as a way of feeding back concerns about the care, whether they'd left the hospital or whether they were in the hospital. And we would then try and deal with it. It wasn't about taking over the complaints process. The complaints process is there and people can do that. But it was about trying to address people's concerns in the same way that you would if somebody walked up to you in the corridor and had a conversation with you, do the same. But the consultants there launched CAT, which was Consultants Against Twitter. And actually some of them even put it on their auto-signature, with just the delight. So part of the job then is about us explaining it and explaining the benefits and explaining that it doesn't usurp the complaints process. It doesn't take over all of the other things that are there, but actually what we're trying to do. And explain to people how it has helped and working through that. So, you know, there was a couple of examples of people that were having trouble, they're in the hospital, they're having trouble, and this was their way of getting help whilst they were there, and we could deal with it, and showing that you could deal with it quickly, which ultimately avoided a very long complaint and hours reading through the complaint letter and getting out and going through all the cumbersome processes that were there, because you could deal with it immediately. So just my top tips, and as I say, I don't consider myself to be an expert on social media. The people I work with at NHS England, at the Trust and others, are the real brains behind so much of the stuff that I've been involved in. But the things that have been really obvious to me over the years, planning and research in absolute the same way that you have a communications plan or a plan for anything that you do. You need a plan for your social media, and there should be a real connection between the business plan and the plan of your social media. And I would say if your business plan's up here and your social media is talking about something else, one of them's wrong. Your social media has to be led by your business plan, or change your business plan. You can't be tweeting about, you know, I don't know, we need more services of this type when this business plan isn't asking for more services of that type. So they have to be continuously linked to do that. The last bit, the last three other bits I love most, which is about steal, beg and borrow. And I have to say, after 15 years in the NHS, we're still not very good at stealing off of each other. And I spend a lot of time working with people where you can clearly tell it wasn't created here, so therefore I don't think this is what we want to do here. It doesn't mean you can't adapt what other people have done, but please just steal, beg and borrow. We do not have the time to keep reinventing everything, and we do not have the money to keep reinventing anything. So please steal, beg and borrow. And a couple of examples, if you're going to create a little guide to advice for staff who work in your organisation about how to use social media, Morecambe Bay Hospitals have got a fantastic one. Go there. If you want to know how to, the size of images that you could use on different social media, don't spend hours finding it. Go to Comms 2.0. Those guys have got amazing stuff. Or how to involve and work with councillors or with Foundation Trust members or whatever. Go to the local government association. Amazing stuff. So don't keep reinventing the world. Don't keep creating it. It's there. Google it. Find it. Make it better if you have to. Adapt it to the local needs. But please do steal as much as you can. Insight, absolutely. Know your audience. You have to be working out who you're talking to. And remembering that social media is only talking to a part of the population. And you've got to remember those others that aren't there. It's more than Twitter. I've already shown the number of people that are on the other forms of social media. So it has to be much more than Twitter. Twitter's very easy. But there are, and I'm a massive fan of Comms 2.0. If you're not, and I'm not some sort of shareholder or anything like that, just a massive fan. And what they're doing is connecting us as NHS people with local government as well. And they run a fantastic course about how you can, if you've got great stuff here for Twitter, actually simply use it on all of the other forms of social media. I think the course is like 100 quid or something. Go on it. It's excellent and a really good way to make sure that you're making best use of all the stuff that you're doing across all the different channels. Make sure your social media is compelling. We all know, you post a picture on your Facebook and you've got, or you post something on your Facebook and I'm doing this, you get 10 likes. If you post it on your Facebook and there's a photo of you with, I don't know, Mickey Mouse hat on or whatever, you're going to get 20 likes. We know how simple it is. We know how it works. And we should be doing that on all of our social media, making it as compelling as possible. Number 5, this is obviously fundamental to all types of communication, so not just to social media. It isn't just a broadcast. We have to be talking to people, having a real conversation, and be willing to engage in that conversation, however difficult it gets. And I get so sad when I hear of hospital trusts blocking people on Twitter and stuff like that. You can't do that. The conversation has to continue, unless it's absolutely offensive or something like that. The conversation has to continue, however difficult it is. We need to be having those conversations, and social media is important for that as anything. And the last bit there on number 5, show love. And I mean this is around thinking, if you've got your account, your hospital account, say, as social media, and you're launching your latest Don't Come to A&E initiative, or you'll get your flu jab, and you sometimes wonder why we don't get as much support. I'd often think to yourself, how often do I, as my hospital trust accounts, ever love the stuff that's going on by the police telling people not to open the door if there's a stranger, or the local housing association encouraging people to give money or give food to the local food bank, or the council telling people to, whatever. We don't do that. And I think there's a big bit about thinking about who your local community are, your local partners are, and showing them love in that way, and supporting what they do. And just remembering that so much of what they do connects back to health and healthcare anyway. So supporting the local housing association, better health, better housing is going to improve the health of people locally. Look at police, look at all the other services. We connect so much. So showing them love isn't then going against your mission, because the mission is to improve the health of people locally. I won't talk about the tools too much. There's an absolute array of tools, and I know others are talking about that today, that you can use to make your social media as great as it can be. And in particular, I think a massive bit connecting into the evaluation piece, how you audit. You must be, number 7, evaluating what you do. And there's a really big bit there about learning from things that are going wrong. And learn fast, fail fast, but learn faster. And a real key message there about working out what you're not doing so well, and then doing it differently, and not living with it not working. And in your head it's not working, but actually what we can do to turn that around and make it work. Number 8 is around the governance. I do think sometimes within social media we can make the whole thing a bit too scary for people. And there's lots of rules and policies and stuff, and I remember, where's our social media policy, and has it been sent out to every member of staff on their payslip, and oh my god, they're going to get us on the Daily Mail if we let them tweet, and let's not let them tweet at all, blah blah blah. I think we can make that sometimes as scary as anything. So you need governance, absolutely, but try and make it light touch. And I think it's about remembering that you trust your staff to have conversations with patients in wards, in clinics, in other areas, about some of the most tragic and upsetting times of their life. So why are you going to try and stop them having conversations on Twitter? You trust them to do that. I think you need to trust them to have those conversations. And I think it's that simple bit. It's if you wouldn't stand up in the canteen and shout this, then don't do it on Twitter. And I think you can get that across the staff. I think that's where you start from. I'm not saying don't have the policies, but try and keep them light touch. And the other bit is about connecting them to the Royal Colleges and to others. And there's amazing guidance on the GMC, General Medical Council, Nursing Midwifery Council, all the Royal Colleges have all got their own guidance, so point them to those. But try and keep it light touch and try not to scare people there. Number 9, don't forget other communications. Social media is just a part of it. I am, and every time I speak about it, I sound like some sort of freak, but a massive fan of printed materials and staff newsletters. And there's, I think, a big rush to sort of move away from that, or not having the argument with people about justifying the cost of it and justifying the cost of the production. We need to be producing the printed stuff as well. We need to be doing that stuff. It can't all go onto social media and just disappear, and you need to be producing those things too. And last and not least, it is about having fun. So have fun on social media and enjoy what you're doing. Just some bits there, some of my faves. These are all Twitter, as you can see, but just some of the things that I would follow and use. I would say that NHS Comms.org, that's about people sharing about across NHS communications. Comms 2.0, I've mentioned that. The NHS account, great. It's only about 7-8 weeks old now. So in Sweden, they had an initiative where somebody who lives in Sweden every week gets hold of the at Sweden account, and they tweet about their experience of living and working in Sweden. We now have that in the NHS at NHS, and every week a member of NHS staff or a patient gets hold of the account and they're tweeting about their experience. 6 weeks in, it just won an award. So I think it's going somewhere, so please support it and please follow it and have a conversation with the person who's holding the account that week. NHS England, I would say that. NHS Million and But NHS, massive supporters of the NHS and promoting the great news that you might not always read about in the papers. And last, I've just whizzed through them, but the last two, David Ford, great tweeting, great stuff, but also amazing lists. So if you want to know who's on Twitter in terms of, chief execs or executive directors or CCGs or hospitals or media or journalists or whatever, David has created lists that you've never seen before. Absolutely amazing. So take a look at his lists and start following people. They're excellent. And last, the We community, excellent, and guide our staff and guide your staff to be joining those communities and to become part of that. Excellent for sharing, excellent for networking. If I can just finish with 3 areas of why I love social media. 2 of these are a bit more glam, and one is, I think, the real reason why I love social media. So one was the NHS for Xmas campaign that ran last year. We whipped Justin Bieber to #1. I think he'd like to say that he came in a bit late and saved the day. I don't believe that. I think we would have still got to #1 without him. Excellent. Why is it important? Winter, really busy time. Amount of NHS staff, round of staff really low. I think it was a massive boost to people across the NHS who work in the system, but also people outside. As we reaffirm our love for our NHS, we need to continue that. And there is actually another one vying for the Christmas #1 this year, which is a hospice initiative. So again, I'd encourage you to support that. Joe Blunden, who's the guy behind this, and I've heard him speak a few times, the stats behind this are just amazing. The number of people that were tweeting, were liking a lot, absolutely amazing. Next one has to be my favourite NHS social media campaign for as long as I can remember. The Missing Type campaign, if you can't see it. So this is where we took the AOs and Bs out of our Twitter accounts, but out of Downing Street. You can see them all there. And the guys behind this. So the reach of this was 2 billion over the campaign. So that's obviously larger than the UK. And they recruited 20,000 extra donors year on year. So it isn't just about, wow, that's great, and we've raised the profile of donating blood. It actually had real, tangible, deliverable results. So 20,000 extra donors year on year. And they relaunched it this year. It's gone international. You can now get it in many other countries. And they relaunched it this year in time for the Olympics. And last and not least, and this is really why I love Twitter, it's about people, and often people in power, having conversations with people and not always being able to have the choice about whether they have those conversations because they put themselves on social media. And the top 2 are from the last week or so, but I could pick these day in, day out, where you've got, and it isn't always chief executives, but these are chief executives. So Mel, top left, chief executive in Warrington of a hospital. A6 is ward, and in case people don't know, EOL is end of life. And her staff, and she didn't know this at the time, took a bayout of operation for a short period of time. So a patient who was terminally ill on that ward could allow and be part of his daughter seeing Santa for the last time. And she tweeted about that. The pride that she would have in her organisation for doing that, her staff doing that, and showing how the NHS, however much we hear the bad, and I'm not saying we don't always get it right, but however much we hear the bad is just so fundamental to see that. And what's important to me isn't that tweet, it's the conversations that follow and how she talks about her staff and how she feels about her staff and how important that was that happened. Over here, those two look like they connect, but they don't really. So over here was Sarah Jane. So she's the chief exec of Birmingham Children's Hospitals, and PICU, Paediatric Intensive Care Unit. So people don't know there's often pressure on paediatric intensive care beds. And the conversation that Sarah Jane was having last week, and it linked into some national stories about a lack of paediatric intensive care beds and children potentially being moved around the country to find the beds for them. And she was having a conversation with people on Twitter about the pressures on her own hospitals and how they deal with it and how they cope with it. The pressure it puts on staff, the pressure it puts on patients, how we might deal with it. But it was having an honest conversation as well about, we can do more of this, but it's going to cost more money. We can do more of this, but we need more staff. And for me, that's about the honest and open way that we can engage and have frank conversations with people. And down the bottom, and I'll finish on this, was a guy, he's a couple of years old now, I'll never forget this, was a police officer down in Devon, and he had a child in his prison cells, my plain language for that, who had mental health problems, and they shouldn't have been in his police station. And he tweeted about it, and it embarrassed us, and it made us go, for God's sake, we need to sort this out. It's still a long way to go, but it's about people in power being able to do things differently and say things, and again, it's the resulting conversation that comes out of that, the challenge that's put on it, the challenge that's put on others. And I think social media has created that. Those conversations can happen at very, very different levels, open, honest, real time, but it's about encouraging our leaders and others to have those conversations. So that's everything from me. I'm happy to take as many questions as possible. The big thing I would just end on is social media is here to stay. I think it has had the most amazing impact on healthcare. It's not going away. Don't miss the things that are coming up, would be my end point. But we cannot ignore it, and it's fantastic. Thank you.
Questions on Slido? I've got some questions on Slido for Antony, but if you want to put your hands up as well, and Cass going to come round with the microphone.
Got the microphone,
but you can see
this could be dangerous.
A couple there, that's the one at the top. Do you want to?
Just yell if you want to ask us.
Cool.
Yeah, you know.
What is the strongest emotion feeling you can remember having using social media? I'd be lying not to say hearing the news of Kate Granger's death, I have to say, earlier this year. And I think that, you know, and knowing Chris, who's her husband, the impact that that's had on him and on Kate, and everything there, I think, you know, that would be me. And it's sort of seeing someone's life play out in real time in a way that you wouldn't expect to see it. So there, and I think that's why when I talk about us as NHS people helping to ensure that Hello My Name has a continuing legacy and doesn't disappear off, it's fundamental. See there? Will the NHS continue to invest in comms, or will it suffer through cutbacks in office spending? I think that's as much down to us as it is to the people that hold the purse strings. I think that we need to continue to make our case for NHS comms. The stuff around insight and evaluation, how often do you prove to your board your worth? How often do you evaluate what you do and present that back in a way that they can easily understand and justify what you do? I think there's a clear argument there in times of challenge. So when purse string is tight, when things are changing, actually that's the time when you need to invest more in communications and not less. So I think there's a lot of arguments there. I would also place on us as NHS communicators to be looking forward about how we can work with others to join up. So when I talked earlier on about hospital chains, I would connect that to us as NHS comms people. So how well do you work with other NHS communicators locally? If you're a hospital with your mental health trust or community trust, are you sharing resources? Could there be opportunities to share people in time? Also looking at local government, looking at charities and the like. So I think there's also a message to us about how we do it. I'd hope NHS comms isn't cut. Times are tight, but I think we've got a good case to make and we need to have the argument. How social media plays a role in the selection of GPs. I don't necessarily understand that one. Is the person there? Does the person elaborate? Will we all get slides after the event? Yes. I think they're the only ones on there.
Could I ask what contribution social media might have to meeting needs under the public sector equality duty?
Wow. Elaborate, help me on that one, because I don't think...
Public sector equality duty is from the Equality
Act,
major legislation, and public sector bodies, anyone working for the NHS, commissioners, providers, need to demonstrate that they have consulted competently and effectively, and particularly how the range of social media can contribute to that. or development of joint strategic needs assessments.
So I would just see that, hopefully I'm answering the question rightly for you, so that's an extension of the other forms of communications that we have. So I think social media is important there in the way that we, engage in, conversations and public meetings with people. Then social media is another form of doing that. I think the one thing I would say, and I probably didn't say in there, is the importance of connecting it all together, that these things aren't done in isolation. And I think there is a risk of that you can have your social media over here, working in this way and not connecting up to the, the events that you're running or the staff communications you have, or other things like that. So absolutely bringing them together. But yeah, fundamental. If I look at, so maybe some examples. So if I look at the work one of our vanguards at Dudley have been doing, so they are doing a massive piece of work around taking specialist care out of hospitals, put it in the community, but also how they're connecting up with local organisations, and they've been running a consultation on that. So massive, as I would call it, digital piece, work around social media, but also still, and they had a VW camper van going out to all the local parks and doing that as well. So having them together and running together, but their evidence to prove what they've done is as much from that camper van as it is from the online and the digital work. Does that answer the question?